for giving me the opportunity to present the result of our study talking about HIV self-testing acceptance among adolescents living in the street. Please note that I'm a French speaker, so I kindly ask for your understanding regarding my English. We have no conflict to declare. HIV remains a major public health challenge among adolescents, with more than 1 million of them living with HIV worldwide. Despite efforts made to increase case identification, HIV testing remains suboptimal among hard-to-reach population, especially among adolescents living in the street. HIV self-test has been shown to be effective in improving HIV testing among hard-to-reach population, but remains poorly described among ALS. The main objective of this study was to assess acceptance and uptake of HIV self-testing and associated factors among ALS in Côte d'Ivoire. More specifically, we wanted to estimate the proportion of adolescents who accept to use HIV self-testing and identify factors associated with the acceptance of self-testing. To respond to these objectives, we conducted a cross-sectional study among ALS of 3 health districts in Côte d'Ivoire in March 2024 and April 2025. We started by mapping hotspots, locations where adolescents commonly gather or seek services. We set up a space for adolescents in each district hospital with a patient flow designed to meet their needs. Every adolescent who visited the ALS Corner was invited to complete a questionnaire about their social, demographic, and street life characteristics and sexual behaviors. They were then offered an assisted oral HIV self-test, followed by routine HIV testing according to the national guideline. We define acceptance of HIV self-testing as the proportion of adolescents who agree to take the self-test. To identify the factors associated with this acceptance, we use a logistic regression model. The Ministry of Family, Women and Children, through the Program for the Protection of Vulnerable Children and Adolescents, was the legal representative of adolescents under the age of 16. So we enrolled 1,181 adolescents with a median age of 17. Among them, around 15% were female, 44% had never attained formal education, and around 76% had been living in the street for more than 12 months. We asked them about their experience with HIV testing. Only 11.2% had ever been tested. About HIV self-testing, only 4% had ever heard of HIV self-testing. Among those, around 47% had previously used an HIV self-test. We explore the acceptance of HIV self-testing among ALS by asking them if they would accept HIV self-testing. Among the 1,181, 940, which represents around 80%, accepted to use the HIV self-test. Among them, 72.2% agreed to report their result to the healthcare staff. For operational reasons, HIV self-testing was offered to a subset of 390 adolescents out of the 940 who initially accepted the test. Among those who performed the self-test, around 80% were able to correctly use the self-test. This included successfully performing each step of the procedure and accurately interpreting the test result. Among them, 6 gave a reactive positive result, including 1 confirmed case. This case was successfully linked to care and initiated on antiretroviral therapy. The analysis of factors associated with acceptance showed that female sex awareness of HIV self-testing, previous experience of stigma in healthcare settings, and drug use were significantly associated with greater acceptance of HIV self-testing. In contrast, fear that HIV testing could draw attention to their status as living in the street was negatively associated with acceptance. Compared to other studies, our acceptance rate aligned closely with findings from Kenya, even if it was lower than rates reported in Togo and the Democratic Republic of Congo. Regarding correct interpretation of results, the proportion of participants in our study who used the self-test accurately was as high as in the studies conducted in Togo and the Democratic Republic of Congo. Drug use was positively associated with acceptance in our sample, which could be explained by adolescent awareness of the risk of HIV transmission associated with injectable drug use. The negative association between acceptance of HIV self-testing and fear of stigmatization due to their status as ALS could be explained by the general avoidance of healthcare settings for result reporting due to stigma related to their status as street-connected adolescents. At the end, HIV self-testing is a well-accepted and promising strategy to increase HIV testing among adolescents living in the street. To maximize its impact, targeted strategies should focus on raising awareness among adolescents about HIV self-testing and how to correctly perform it. Issue of linkage to care should be carefully considered. Equally important is reducing stigma and preventing discrimination in healthcare settings, which should be addressed by involving sensitivity training for healthcare workers, a priority that should be included in national health plan. We thank the EIS for funding our project through the CIPHER grant. We also extend our gratitude to the adolescents who agreed to participate in this study, as well as to the NGOs, institutions, and partners program. Thank you.